So let's talk today about Medicare visit limits. So a lot of us in the field, especially I hear from practitioners in skilled nursing facilities and home health, have issues with agencies and facilities wanting to put limits on either the length of our visit or the number of visits that they receive. Or there's this idea that there's this total number of visits and OT gets this many and PT gets this many, where you have to be in there at least 30 minutes, those sorts of things. And I want to stay upfront that if it's a Medicare patient, a traditional Medicare patient, those things are absolutely false. Medicare does not put any kind of limitation on either the number of visits or how long or short a visit has to be, besides as long as you're complying with the 8-minute rule. So at a minimum, your visit has to be 8 minutes if you're going to bill for any kind of therapy. So a lot of the reasons why facilities have visit limits, it can be for a number of reasons, but the primary one is to try and control costs. So if your facility is not filling out OASIS information accurately or the MDS information accurately, Section GG, they may be leaving money on the table that isn't allowing them to pay for the services that the patient needs. Now, Medicare requires that patients receive access to medically necessary and reasonable services, something that's skilled. So the first question to ask if you're having these issues is, one, are your services truly needed? Are they skilled? Are they reasonable and necessary? Are they appropriate for the patient? Would you pay for the services that you're providing? So do they meet those qualifications, and are they really needed? Or are we just providing therapy because maybe it'll help? We have to know why that person needs therapy. And then secondly, we need to look at the policy and be prepared to bring that up with management. Just complaining about it on social media or to our friends or after a meeting isn't really going to do a whole lot. We need to talk to the people who are in charge. And oftentimes policy has gone through kind of a long game of telephone. So the people who are telling you about the policy may not really understand what's going on, or they've just been told by their facility that we have to control costs, and the way we're going to do this is by telling therapists they only get 4 visits, whatever it is. But in order to advocate against those kind of things, we need to have evidence as to why that's not allowed or why we need more therapy. And then we need to make sure that we're being good stewards of our time and expenses, because therapy is expensive for the employer. We cost a lot more than ancillary services, so we need to know why they should be paying us and not somebody else. And so just going into your boss and saying, well, this isn't fair and I deserve more, isn't really going to be the good way to go about it. We need to bring the policy with us and show them what it covers, and we also need to talk about how our services are going to help them meet their goals. So I hope that gives you some ideas, and make sure to follow me at Amplify OT for more things about occupational therapy policy and advocacy.